Okay, we're live. Hello, it's Bill, the knee pain guru. Today is Monday, July 12th, 2021. Let's see, we're going to talk about bending your knee after ACL surgery. This is a good one. I have my own personal experience with this one. This was my injury. So I really understand the pattern of how the knee needs to turn and twist to tear the ligament and get repaired. So the ACL injury is like my own. That's how I got into all of this. This wasn't my when I threw the softball to first base the very last time I dislocated my left knee. It wasn't like in my mind that, oh, I'm going to make this my day job. I'm going to pursue this, to realize that once you're on the other side of the surgery and the physical therapy, that the docs and the PTs don't have a whole lot to offer in terms of getting the neurology of your knee, your leg, your body to function in conjunction with each other. And I'm going to get into this was a YouTube question that was posted by Nicole, and this was back on July 8th. So where are we? July 12th. So that was like four days ago. Okay, Nicole says, "Hi, Bill. I had an ACL reconstruction surgery. I can't bend my knee. When I try, it hurts so bad. People, what can I do to get my knee to bend?" Now, here's an interesting piece. Shortly after ACL surgery, you have two things going on. One is three things going on. One is the actual injury itself. So you tore the ACL, you have trauma in the body from that. You have compensation patterns in the body from the initial injury. The ligament tearing, possibly meniscus. That's what happened with me as well. I tore two pieces of meniscus in addition to the ACL tearing. So I had multiple dynamics going on. So you have the initial injury itself. Then you have the surgery. And even though the surgery is there to help the damage that was caused by the knee, it's still an additional trauma. So it's a good trauma in a way, but yet it's a trauma to your body nonetheless. There's the anticipation before the surgery. You're put under anesthesia. You don't have control over what's going on. So your body is perceiving that experience as a threat as well. And then the doctor, depending on the type of ACL surgery, you have patella tendon, you have a hamstring graft, you have cadaver. All of those provide a different challenge in terms of the follow-on after the surgery. The patella tendon, which is your kneecap tendon that they take a part of that to replace the ligament in your knee that was torn. The knee that they take the tendon from is going to make a difference. They could take it from the same knee. They can do it on the other knee. There's the hamstring graft where they take part of your hamstring and reconstruct it. So you have pain. There's different tension patterns. There's different pain patterns your body will have after the surgery that will make it challenging in recovery. You have the cadaver, which is the least challenging because you're actually taking the ligament from a person who has been deceased. And now the doctors are still drilling holes for pins in your tibia, which is the bone in your lower leg, and the femur, which is the bone in your upper leg, to reconstruct the ligament in your knee that is torn. So you have the trauma from the surgery. Then you have the trauma after the surgery, which is the process that Nicole is in, that you have physical therapy. They're pushing the knee. They're forcing the knee to increase the range of motion and strengthen the leg, which absolutely has to be done. You have to strengthen the leg. I was shocked as how quickly my left leg atrophied atrophied, meaning the muscle shrunk. It seemed like it was 2 days after the surgery. I looked down and I was like, oh, it shrunk to like that of a pencil, and it really freaked me out a little bit. So I was like, okay, I got to get on the exercise. However, the part of the exercise and the strengthening is you have to push through the pain. So there's a little bit of a disconnect in terms of, well, you want to push through the pain to strengthen your leg so your leg doesn't atrophy and stiffen up. But the process of exercising and strengthening the leg causes more pain. So it's a little bit of a, dog chasing its tail, or you're on the hamster wheel, that the more you try to do this, the further it seems you're getting away from the result that you want, which is the knee being out of pain and having full range of motion in the knee. So we have to take these factors into consideration in answering Nicole's question, which, by the way, we have some people online here on YouTube as well as Facebook. If you have questions, please ask those in the comments section. Oh, and make sure to give the video a thumbs up, like, and subscribe to the channel, Knee Pain Guru channel as well. Would appreciate that very much. Okay, so now we have the range of motion that we're trying to gain in the knee to get the knee back to normal. There's factors that conventional physical therapy doesn't look at. One is they're only looking at the knee. The body is a mechanical system that is like a series of pulleys and levers. And in order for the knee to have full range of motion, you also have to have the full range of motion in the hips and lower back, as well as the ankles and the feet, in order for the knee to fully bend. That is lost on the conventional medical model. I don't know why. I don't understand. Please don't ask me why, because I don't know. It's job security for me, which is cool. However, it's important, it's imperative that if you want to gain full range of motion in the knee, bend the knee fully, straighten the knee fully after ACL reconstruction, we have to also free the tension patterns that are going on in the ankle, the knee, the hip, and the hips and the lower back as well. Because in order for the knee to fully bend and fully extend, you have to have the hip, the lower back, and the ankle involved to do that. Maybe not the ankle as much, but it does play a role. You have tension patterns that are going on from your feet all the way up to your head. So we have to look at those tension patterns all the way up and down the leg. So that's the first piece. The second piece is the swelling and inflammation from the damage from the initial injury and the surgery. Now, the surgery, once again, covering that it is helpful, it is beneficial. It's also a trauma. Trauma to the knee, trauma to your body. And that needs to be addressed from a neurological perspective, meaning the signals that are going through your body when you walk, when you stand, when you sit, when you squat. Those signals have to be clear in order to allow the knee to fully bend and fully extend. Otherwise, what happens is you're fighting your body to bend and extend the leg. You're fighting your body in the same respect that if you're driving a car with your foot on the gas and your foot on the brake at the same time. You're asking, well, why isn't the car going? Well, because you have your foot on the brake. Now, this isn't your fault. Now, understand, this is not your fault. Your body does this. This is a normal, natural response to a trauma, an injury, an accident, a surgery. It happens. And this is like your body jams on the brakes because of that experience. And now it doesn't know how to let that go. This is trauma stuck in the neurology of the knee, the leg, and the body. the more we begin to understand it and see the body as a whole, not just the knee, not just trying to increase the range of motion in the knee, not just trying to strengthen your legs in the hopes that you'll push through the pain and somehow you'll get the range of motion back in your knee and your knee won't be in pain. It doesn't, your body doesn't work that way. That's not how it's hardwired. That's not how it works. So, addressing the inflammation in the knee as well as systemically in the body. That's another thing that needs to be addressed, because we have inflammation locally in the knee. We also have systemic inflammation in the body. Inflammation in the guts, inflammation in the gut. All of that inflammation together slows down your body's ability to heal what's going on in the knee. What would cause systemic inflammation? Well, our diet. That can contribute to that. What we eat or what we don't eat. What we drink or what we don't drink. That can contribute to systemic inflammation. But one of the things that causes systemic inflammation is the sheer stress of the experience your body is going through. The stress of the injury, the stress of the surgery, the stress of the recovery after surgery can cause systemic inflammation. We have cell phones. When we talk on them, when we're in and around towers, that emits signals that our body picks up that can contribute to systemic inflammation. We have the anesthesia from the surgery. The medications we're taking to numb the pain can contribute to systemic inflammation because it's not something natural that the body goes, oh, yeah, that's great. I'm going to feel better as a result of it. It numbs the pain. However, in my case, they gave me Percocet. Percocet made me vomit, which I had the choice between feeling the pain in my knee or vomiting because of Percocet. It wasn't a real great option for me. So I cut out the Percocet and dealt with the pain. They also gave me another medication to deal with the nausea that I was getting from taking the Percocet. It was just, I was done with that. Address it with diet, with proper hydration, looking at supplementation to support the body's ability to heal what's going on. And then the big thing we got to look at is changing the neurological signaling. Now, neurological signaling is looking at the intrinsic movement of the joint. So when you think of the movement of the knee, you think of extension and flexion. Extension and flexion. However, the joint, the knee joint, slightly twists, slightly moves side to side, slightly moves forward and back, slightly moves apart and together, slightly tilts. And when the knee bends, the way it's supposed to properly bend, there's a corkscrewing action that takes place in the knee joint when we bend the knee. But if our body is holding on to these tension patterns to protect from the initial injury, from the surgery, from the follow-on from the physical therapy, all the hesitation, you're walking around because you don't want to fall, that builds up tension in the leg, in the knee, in the hips and lower back, and it contributes to what you're dealing with. So this is a bigger picture of what's going on. Very dynamic approach. We have to look at many of these factors in order to get the inflammation down in the knee, relax the tension in the joint, and allow the body to begin to increase the comfortable range of motion. Comfortable range of motion is very different than just forcing the range of motion. Comfortable range of motion is what you could bend your knee, bend and extend your knee, the degree that you can bend and extend your knee without causing pain. without having problems. So, okay, that was a whole lot of information. I will give time for questions if you have any. There was somebody actually hitting me up through Facebook just before they had questions about their ACL. And the situation with the ACL is going to be pretty consistent across the board as far as people who have ACL injuries. Now, there's going to be nuance to it based on, like, I dislocated my left knee 4 times. So I had, before I went to the doctor. Don't be like Bill. You want to get this addressed as quickly as possible after the injury, and then that's going to allow for the body to get on to the healing as quickly as possible. What was I going to say? The patterns in the body are going to be very similar. Everyone's situation is going to be unique. It very rarely is scar tissue going to be what is inhibiting the knee from fully bending. It can play a role. I'm not saying that. But the mechanics of it in terms of getting the body to get out of pain and increase the range of motion is going to be the same across the board, which is first we want to create comfort in the joint. When we create comfort in the joint, we get the pressure off of the tiny little nerves in the knee that are causing pain. And then that changes the neurological signaling in the knee, allowing the body to relax. That's going to be the first step in terms of moving the body in a place to increase the comfortable range of motion. Then we have to look at, so that would be step 1. Step 2 is going to be setting up the conditions in the body. So that looks like water, nutrition, breathing, mindset, supplementation, stretching, mobility, and then exercise. We want to make sure that we're incorporating all of those like a recipe for baking a cake. You want to have the right ingredients in the right amounts, in the right order, with the right timing. And that is going to create what your knee needs in order to heal, what your body needs to heal your knee the quickest. So that's the second step. First step, once again, is creating comfort. Second is setting up the conditions so the body can begin to heal. And third is avoiding the landmines and pitfalls that inevitably are there. And one of the common ones that I see, it's like the knee starts to get out of pain. You immediately want to test it. You immediately want to try it out. You're hesitant, you're afraid, you're scared, but you're going to try it anyways. That's not what you want to do in that space, because trying it in that place, there's still too much fear in the neurology. There's still too much fear going on in the body from the injury, from the accident, from the subsequent physical therapy that we want to dissipate from the nervous system. We want to get your body to heal, and we want to get it to heal in the shortest amount of time. So in that space, giving your body a chance to recover. You think of it like I'm planting a seed. So I've created comfort, set up the conditions so the body can heal. And then we want to look at avoiding those landmines and pitfalls. It's like planting a seed in a garden. We don't want to plant the seed in the garden and water it and then look at it the next day and think it's going to already be sprouting and blooming. It's going to take a while. It's the same thing when you've damaged what's going on in your knee. You've had ACL surgery. What we want to do is get to a place where you want to give that nurturing and support that your knee needs in order to be able to heal itself. Hey, Kim, thanks for being flexible on Wednesday. If you got questions, please let me know. Kim is one of the clients that I work with in person here in the Asheville, North Carolina area, Western North Carolina area. And she's great. She gets it. It's very cool. If anybody else has questions, please let me know. Make sure to share this video with your friends, your family, your loved ones, especially the ones that limp. They're easy to spot. If you have had ACL surgery, please enter your questions over on the side. There's an interesting piece about ACL surgery. There is my life before I injured my knee and my life after I injured my knee. And it's like the ACL, the surgery date, which was June of 1999, was like the delineation point in my life. So once you've had an ACL injury like that, it's like there's everything, for me, it's everything before June of 1999, and now there's everything after June of 1999. So I really understand this pattern. There's another pattern that is just popping into my head that was a tremendous relief in terms of gaining full flexion and extension of my knee, was looking at the rotation of the femur as it relates to the hip socket. This was a big one. That once I addressed that tension pattern, everything shifted. I was able to fully kneel after that. As a matter of fact, the scar, which was dead center on my knee, shifted 1/4 inch, which was just enough that I wouldn't be kneeling directly on my knee, and I was able to get back to judo and fully kneel. So that was pretty cool. Kim, if you, I can share that with you on Wednesday. Let's see. Anybody else? Okay. Well, if this information sounds good and you're like, okay, what do I do next? And this is really important. Like action steps. It's great to hear information on the internet, but if you don't implement that information, that's the difference between information and knowledge. Information or wisdom and knowledge, sorry. Knowledge is just gaining information. Wisdom is actually implementing the information that you gather and putting it into a life experience that you have something to bounce off of. And that's what I see many people live in hypothetical land. They have lots of knowledge. They talk about things on how the knee is supposed to work and how the knee is supposed to heal. However, we have to bring that information and get it grounded. We have to get it to land for us or for you in your body's healing. And if we don't land it, what ends up happening is you end up on the hamster wheel. Well, I tried it. Well, I kind of tried it. Well, I only did it for 1 day. Well, I did it a couple days last week, but I wasn't consistent. I was busy and I didn't finish the workout. There's lots of things. And what's very important is how you do anything is how you do everything. How you show up to implement a process to heal your knee is going to be how you do everything in your life. And that is very much true. And when I heard this the first time, I was like, oh, okay. And I knew I needed to change within myself to begin implementing the things that were going to make a permanent and long-lasting difference for my knee and for my body. Because it's great to work out and exercise only for a period of time to run into another injury that then sets you back to the beginning. That gets old real quick. What we want to do is get you out of pain. So you have a real solid foundation to work with. You have the experience back in your body that your knee doesn't hurt. Your body doesn't hurt. It's good. It's easy to sleep. And then from there, we want to build upon that. We want to build back in good habits, good structure into your life that is totally doable and manageable, like little baby steps. And what that does is that builds upon your experience So now you're really enjoying your life and your body moves really good as you get older. And let's face it, the older we get, the more difficult it is to heal, the more difficult it is to move, the more difficult it is to motivate ourselves. And it makes it even doubly challenging when you have a knee injury that you're trying to overcome in terms of doing that exercise and health and mobility that you want to have a rich, healthy life as you get older. So, okay. So you can what you could do next. Here's what you could do. If this information sounds good, head on over to my website, thekneepainguru.com. I have a newsletter over there. You can check it out. You can check out the newsletter, get on the newsletter list. I'll send you emails that'll change your mindset about how your knee heals and all that kind of good stuff. You can, if you'd like to set up a time for an appointment, okay. Okay, I think we're back. Okay, I think we're back. Okay, good. Set up a time for a consultation. This is where we're going to figure out a strategy for what's going on with your knee and take in information, figure out the best way for you to get out of pain. That's not for you to get out of pain on that appointment. That is to develop a strategy for you to get out of pain. There's a big difference. We can't just one-off these things. We want, like, if you're just looking for exercises or a few things to do, I'm not your guy. I'm like long-term people that want to make real permanent changes. So that's an appointment to begin to develop that strategy. And then to really help you out, is my group coaching program called Knee Club. And that's where we meet twice a week in a group coaching call, where I will point out the specific videos in a members area of the website that are going to make the biggest difference for you. You do those for homework. On the next call, you check in. You let me know how it's going. And then we pivot. We tweak and adjust the program so it's customized to your situation. We got some questions. Let's see what we got here. Let's see. Kim said, since working with Bill since May, my hip pain resulting from a series of traumatic injuries has become increasingly debilitating over the past 4 years, have been reduced by 75%, and my stiffness by at least 50%. I had been going to chiropractors and massage therapists throughout that period without sustained improvement. Okay, and I can explain why that happens for those that would like to compare what we're doing here in Knee Club or what I'm working with Kim in person here in the Asheville area. I can explain the difference. And here is the difference. Think of a tent pole, and you have ropes on a tent pole. The tent pole is flexible. The tent pole will bend in the direction of the tightest rope. Make sense? You got a tent pole. Tent pole is your spine. Wink, wink, nudge, nudge. And the tent pole will bend in the direction of the tightest rope. And then once you release the tension on that rope, the tent pole will bend in the direction of the second tightest rope, which is now the tightest rope. Eventually, what happens is if we release the tension patterns off of all those ropes, the tent pole will be straight. This is the very same thing in your body. When you go to Kim was talking about, let's see, she was talking about chiropractors and massage therapists. The chiropractors, and this is not to say all chiropractors across the board, chiropractors are looking to take a bone that's out of place and put it back into place. And that'll give relief to the body for a period of time. But what's not being addressed is changing the neurology that is causing the bone to be pulled out of place to begin with. This is why many chiropractors will have you on, coming a couple of weeks or three times per week, a couple times per week, 3 times per week for an extended period of time. They want to sign you up for that package because they're putting the bone back into the place, the bone comes out of place. They want to put it back into place again, the bone comes out of place again. And over time, that eventually has the potential to hold. But what's not being addressed is the tension patterns that are pulling the bone out to begin with. So that's what Kim and I are working with. There are certain patterns caused by sitting, standing, moving, lying down, stress from life, financial issues, relationship issues, traumas, injuries, accidents, surgeries, you name it. And it causes our body to compensate and pull these things out of place. Our body isn't in alignment with gravity. And the more we can address these tension patterns that are going on in the muscles, the tendons, the ligaments, the skin, the fluid, the fascia, it allows the body to line back up on itself. Well, when it lines back up on itself, natural mechanisms that are present when we're born, the body heals. The body knows what it wants to do. We're just getting out of the way. We're not inhibiting it from doing the healing. So that's why, chiropractor is is the example of the bones, putting the bones back into place. Massage therapists, and depending on the type of massage therapist. So this is not all massage therapists across the board. For the massage therapist that's strictly, trying to stick the elbow or rub to relax the muscles, that's nice and it does well, but it's not necessarily changing the neurology on a deeper level that is causing those muscles to be tight to begin with. That's what we need to reprogram. That's what we need to change. Those are the tools that I give you in the context of Knee Club to release those patterns yourself, so you can get yourself out of knee pain, get yourself out of neck pain or back pain, hip pain, or whatever sorts of pain. We start out with the knees. We move on to other parts of the body. That is the focus of how the body has the potential to heal. When we begin to release the tension patterns that are causing the body to feel unnatural or painful or tight or tense or stiff or achy, whatever you call it. So if that's making sense. Okay. Thank you for those that are liking the information. Thank you, Kim, for sharing your information there. Make sure you head on over to the, let's see, the kneepainguru.com website. I've got a ton of information there. Information's been going up there for 13 years. So you're bound to find something there. I've got different categories for bone on bone and arthritis and Baker cyst and meniscus tears and all the fun stuff that goes along with pain in the knee. That's what I got. No more questions. So head on over to the kneepainguru.com, sign up for Knee Club, get on the newsletter list. We have calls with Knee Club on Mondays and Thursdays. Mondays at 1:30 p.m., Thursdays at 5 p.m. Eastern time, both Eastern time. And we dig in. We cut out the fluff and all that. We just get really down to business in getting you relief that you can experience today. So, and make sure, this is before, when you sign up for Knee Club, let me get you that link there. When you sign up for Knee Club, make sure you begin with make sure you get in and start working with the Quick Start Guide before our next call or whatever call you're able to make. If you can't make the call, don't worry. You can leave your questions in the private Facebook group and I get to those. I answer those on the call. The calls are recorded. I post them in the members area. So it's all good. You know, the only reason you wouldn't relieve your pain or reduce your pain beginning immediately is if you didn't put in the effort, and then I wouldn't be able to help you anyways. So, okay. I got to go. Let's see. I got a meeting, 11 a.m. Okay. Thank you so much for being here. Thank you, Kim, for contributing. Everybody have a wonderful day, and I will see you on tomorrow's video.